Good afternoon, everybody. I will present one study that is about Netarsudil, role of Netarsudil in open-angle glaucoma. Study design is, this is a multi-center, prospective, interventional and open label study. That is the medicine given to the patients is known to both the treating doctor and the patients also, reflecting real world practice. Primary open angle glaucoma patients who are on 1 to 3 anti-glaucoma medications with borderline IOP, means 18 to 20, were randomized into 2 groups. All patients were instructed not to stop existing anti-glaucoma medications. Netarsudil 0.02% eye drops was added to the treatment group and effects were studied till 12 to 14 months of therapy. Purpose. The primary purpose was to study IOP lowering effect of Netarsudil 0.02% in patients with uncontrolled POAG who have baseline pressure of average 18 to 20 millimeter mercury. Any adverse effect of the drug was a secondary outcome measure. Methods. 60 patients were selected with diagnosed primary open angle glaucoma and baseline IOP between 18 to 20 millimeter mercury with stable visual fields and randomized into 2 groups of 30 patients each. And the patients who are using Netarsudil eye drops, the eye drop vial is labeled with a different color so that can identify. The central corneal thickness was within the normal range, that is 500 to 540 micron. In one group, patients were allowed to continue 1 to 3 anti-glaucoma drugs, the first line being the elatonoprost group of drugs and prostaglandin analogs, and in another group, Netarsudil 0.02% eye drop were added. Patients were followed up on 1st, 3rd, 5th, 9th and 13th month of study. IOP was checked by Goldman applanation tonometer in every visit. Visual fields and RNFL OCT were studied at 5th and 13th month and reviewed. Group receiving Netarsudil 0.02% showed lowering of IOP from first month of therapy and maintained till end of study, means 12 to 14 month of study. The mean IOP lowering was between 2 to 4 millimeter mercury in the treatment group. There was no progression in visual fields, mean deviation, and OCT RNFL, average RNFL thickness in the treatment group. In the control group, 10% of patients showed some deterioration in the visual fields and OCT RNFL. Conclusion. Netarsudil, when added to current anti-glaucoma therapy with borderline IOP 18 to 20 millimeter mercury, showed significant reduction of IOP with stable visual fields and OCT RNFL. The main adverse effect was hyperemia, 50% of cases, which resolved over time. The other remarkable adverse effect was small perilimbal subconjunctival hemorrhage, seen in about 10% patients. A larger patient population with longer follow-up would be more informative. Thank you. Thank you, sir.
Please wait, sir. We can have the questions from the judges.
Sorry.
Yeah.
Sorry, sir.
You agree that it was a very small group you had studied?
Yeah, sir.
So how can you recommend for its use to the audience. Unless you have a long-term study with some emphatic results,
Because
or you want to say that it's a good beginning.
yeah, I can say sir, it is a good beginning because after giving 1 to 3 anti-glaucoma drugs, very small percentage of people rather stabilized and advances. So when putting Netarsudil eye drops, I practically saw that there is some arrest. While in the other group, it progressed to 10 to 12%, I can say. So all are aged patients and all are primary open-angle glaucoma patients and myopia, diabetes, these are excluded from my study.
You studied this molecule alone, or you had compared it with other contemporary molecules?
No, this Netarsudil and other hand there is prostaglandin analog, betaxolol and the third brimonidine. These are 1 to 3 anti-glaucoma drugs on one hand, and other hand with the 1 to 3 drugs I added Netarsudil. These are 2 groups.
Right. So which you recommend to be more
I
efficient?
recommend that Netarsudil should be added because one of my patients, 86 years old now, he was on Netarsudil for last 7 years and he is doing fine. One night also. That patient.
10% cases you have reported subconjunctival hemorrhage.
Yes.
That is something.
Sir, but that is resolved.
Sometimes the patient would feel alarming.
Yes.
Having subconjunctival hemorrhage makes everyone feel alarmed. If
Right.
unfortunately, if you or me have it,
Right.
we'll also feel equally, worried and anxious about it.
Yes,
So how about those patients?
Yes, sir. But in many cases, not many cases, all cases, I explain to patient when giving the first time the drops. These may be the side effects of the drugs. Like when we use brimonidine, we always explain to patient that there will be hyperemia. So in this case also, always we advise patients, there may be some hemorrhages, but don't worry about that. Yes. Sir, actually, all patients, I kept on Netarsudil for 2 to 3 years, like average 2 years. Then when added Netarsudil, just for out of, we can say curiosity and whether it is effective, new molecule Netarsudil missided. So, when we are not control the progression, so we added and try to see whether any arrest is there of the visual field. And